Welcome, everyone, to the second Sovereignty Summit sponsored by the Sovereignty Coalition. My name is Frank Gaffney. I'm the executive chairman of the Center for Security Policy and the co-founder of this coalition with my colleague Reggie Littlejohn, with whom we'll be talking in a bit. We have a very packed program for the next 2 hours. We have been blown away by the response from some of the countries around the world most important to the fight for freedom. And some of their leaders who we will have with us representing their countries, representing their people, representing the cause of freedom are, I believe, both extraordinary human beings and the kind of people that we're proud to be associated with and to be showcasing here. We're going to begin the program, which will be very, very punctual, we hope, with one of the most, I believe, accomplished and sadly criticized frontline doctors in America and, well, indeed the world. His name is Dr. Peter McCullough. He is an internist, a cardiologist, and an epidemiologist by training. He has been punished harshly for his truth-telling about the COVID pandemic. He is the co-author in a book describing his experiences entitled The Courage to Face COVID-19, Preventing Hospitalization and Death While Battling the Biopharmaceutical Complex. We are proud to have him kicking off this program on a busy day with patients. And Dr. McCullough, the floor is yours.
Thank you, Frank, and thanks to each and every one of you for attending. As introduced, I'm Dr. Peter McCullough. I'm a practicing internist, cardiologist, research epidemiologist in Dallas, Texas. I focused extensively on infectious disease and pandemic response now over the last 5 years. And in the first Sovereignty Coalition Summit, I pointed out that the World Health Organization was complicit in the creation of SARS-CoV-2 in the Wuhan Institute of Virology. They worked to conceal the origins of the virus from the laboratory, and that they had misled the world on every pandemic response measure as we worked through the crisis. But the WHO didn't stop there. I want to make the point that the reason why, as a physician, I won't follow the World Health Organization, and I'm advising that member nations pull out and certainly not support the Pandemic Treaty Alliance or International Health Regulations, is that the WHO has greatly misled us on monkeypox and the worldwide monkeypox crisis, which never evolved into a crisis. WHO never fully informed us that it was so easily treated with an IV drug, tecovirimat, that vaccination was never needed for monkeypox. Ultimately, it was never even evaluated for monkeypox after the onset of the outbreak. And now we are in an avian influenza H5N1 crisis declared by the World Health Organization. And by review of its most recent July 26, 2024 update from the WHO, the organization is misleading the world by quoting a 52% mortality in humans from bird flu, which is from legacy data in Southeast Asia, where there is a massive exposure of families sleeping with chickens, no health care. And the review of the x-rays reported in New England Journal of Medicine 2005, it's my determination that these individuals died of secondary bacterial pneumonia and not avian influenza. So we're in the middle of an outbreak of avian influenza since 2021. WHO is failing to inform the world how it's spreading, and research indicates it's spreading by migratory waterfowl, mallard ducks and other waterfowl. WHO fails to indicate that it's a result of gain-of-function research, serial passage done in projects that are published in their research format by the USDA Poultry Research Center in Athens, Georgia, the University of Wisconsin School of Veterinary Medicine, and Erasmus University in the Netherlands. And the WHO is failing to inform the world about which cases are arising from vaccinated poultry. And poultry's been vaccinated against H5 families of influenza in Southeast Asia for decades, and the vaccination has grossly failed, obviously, because there are more cases. And finally, the WHO is not revealing that the current outbreak in both animals and humans is very mild. They report on no information on mortality rate from the infection in poultry or other animals, or including mammalian species. No indication that there are no humans who have died or even been hospitalized with the current strain of bird flu, and no information on the use of virucidal nasal sprays, gargles, even virucidal eye drops. We have a situation here where the WHO is completely inadequate on pandemic crisis after pandemic crisis. And in conclusion, I would make the case that the WHO at this point in time is disposable, and that the world should look towards leaders in each and every country for taking initiatives, helping protect their populations against purported infectious disease threats as we move forward. WHO in no way should have any input over plants, animals, or humans from this point forward and throughout the remainder of human history. They've greatly misled us, and this group is withdrawing all support for the World Health Organization. I'm Dr. Peter McCullough. Thank you so much for having me.
Dr. McCullough, thank you for joining us. Your message was vitally needed. It sets the stage for the rest of our conversations about the globalist assault on not only public health, but sovereignty and freedom worldwide.